Hi, my name's Ashley. I am a speech therapist and I work up at Brooks Rehab in Jacksonville, Florida. I am a friend of Jamil's. I guess I know him through some mutual friends. Got to know him a little better after a ridiculous game of Assassins and then some pretty poorly executed pranks back in the day, which thankfully he's a great guy and we're all still friends. But I'll let him share those details if he feels like it. But I guess he asked myself and some other therapists just to make this video, talk with you guys about how the information you're learning in his class about human development in different stages and the different domains, cognitive, physical, social, emotional, how those things kind of play out on a daily basis in dealing with patients. So just a little background about myself. I am a Gator grad, so go Gators. I did my bachelor's and my master's at UF, which is what you have to practice as a speech therapist, is your master's and then a 9-month fellowship, and then you can become licensed to practice and see patients. So I've been doing that for a couple of years now. I've been up here in Jacksonville within the Brooks system that whole time. It's a huge system. It's got lots of different locations, and speech therapy itself has a lot of avenues you can pursue and populations you can work with. And I've kind of worked with a little bit of everything since I've started, but have kind of settled into over the last year now doing cognitive rehab therapy. So I work a little more specifically with thinking skills. Still do some language therapy, but primarily with adults. And I do things like attention training, memory training, thinking skills, information processing, speed, judgment, problem solving, organizing, all those kinds of things. So I do. There's a little bit of overlap there with traditional speech and traditional occupational therapy. But a lot of times I'll get referrals from OTs or speech therapists who have done as much as they can with a patient and are not entirely sure what to do with them. So I do a little bit more higher level kinds of things. So as far as how human development impacts, what I do, what speech therapists do on a daily basis, it really is just such an integral part of our decision making, our clinical decision making on an everyday, every patient basis. So working with peds, working with kids from little babies, and doing, feeding, swallowing kind of issues all the way up to school age children, doing, yes, those S's and R's, but also some language therapy, some social training for kids like with autism. It's all about development. You have to really have a really, really solid understanding of cognitive, linguistic, social development, and that way you can figure out where this child falls on that spectrum, and then where they should be for their age, and then what you're going to do to help get them there and kind of help move them up that hierarchy till they can get to where they should be developmentally. So, even for things like a nonverbal child or a kid with autism who isn't speaking, it's really important to understand those preliminary stages of language and communication, nonverbal language, cause and effect, basic attention skills, all those kinds of things that you kind of have to really pinpoint where this child's at in order to get them to understand those things before you can ever get them to a place where they can, learn meaningful language and use it to communicate what they want, what they need. So that's really important, as well as, socially, that's a big deal, understanding how this kid interacts with their family, with their support system, with you as a clinician, how to best interact with them, understanding their social style, if they are, going to be distracted easily, if they are shy, if they have trouble making good eye contact, all those kinds of things are going to affect what you decide to do each day in therapy. I work a lot more exclusively with adults now, so I do mainly traumatic brain injuries, TBIs, strokes, a lot of dementias, some normal pressure hydrocephalus, or just encephalopathies, anything where there's some type of insult to the brain or the nervous system that could disrupt those signals and cause some difficulties thinking or communicating or swallowing. So as far as adults go, it's still really important to understand development, especially in any kind of rehab field, whether it's PTOT or speech. Just really understanding, what that regular development is, what that neurotypical development is, what the different courses are for different disorders such as cerebral palsy or, Parkinson's disease, how that progresses, even though that's a later onset, really understanding the different ways that these diseases can stunt or alter development as a patient gets older. Another aspect, though, that I think I have, as a new clinician, I maybe didn't put enough emphasis on, was that social and emotional development, especially for adults. I work with a lot of people over 65 and older. So first of all, just understanding the regular cognitive changes, physical changes that happen in the brain and how that affects, you socially, how that affects you emotionally, and then how those different areas can have ramifications on your physical and cognitive well-being and the things that you're able to participate, since you are a holistic person. All these things are intertwined. And you can't just treat a symptom without treating a person and looking at all those areas. Well, you can try, but you're going to be really crappy at what you do. So, things like as your brain gets older, you're near 60, 65 and beyond, a lot of times you're going to become more forgetful. CRS, can't remember stuff, common complaints. Your information processing speed's going to be lower. You're going to have, poorer attention. So keeping all those things in mind, but then also knowing that as you get older, you're more susceptible to depression, to anxiety, to adjustment disorders from those big life changes, as well as then you're more prone to isolation, to some, just socially having some difficulties, losing your friends, not having the stimulation that you need to keep your brain healthy, to keep your body healthy. So keeping that in mind and really making appropriate referrals when it's necessary. I refer to psychology and to physical therapy, probably even more psychology, but definitely some different therapy professionals a lot, just to try to get as much input as possible and make sure that I am looking at a person as a person and not just a speech disorder, and really looking at how they are developing as far as emotionally, socially, physically, how all those things are going to impact what I do. So if they are depressed or anxious, they're not going to think as clearly, and making sure that we address it or send it to a professional with that expertise who can. Another good example would be of how this kind of development affects, what I do daily. I have seen, a really good example is I've worked with a few people who have very similar gunshot wounds to the head. I've actually worked with a 16-year-old, a 30-year-old who had a gunshot wound when she was like 4 or 5, and then an older adult as well. He's 45. So the way I tackle each of those patients, even though their injuries were very similar kind of symptoms, is very different based off of, where they were developmentally when they had this injury. So, for example, the 30-year-old who'd been shot when she was 5, totally different scenario, because technically she, in a lot of ways, socially, emotionally, she was still at the level of a 5-year-old and had not been able to progress. So how I dealt with her, how I decided, what we were going to do based on what would motivate her, what she cared about, to keep her motivated to work hard and get some progress. That was totally different than what I did for the 16-year-old boy or the 45-year-old guy who is, a fully functioning adult when this injury happened and he's trying to get back to work. So I think, if anything, as far as, I think the most important thing moving forward, going into any kind of healthcare profession, is to just remember that, you are going to be treating patients, but they're people, and to not only focus just on your area, whether it's, physical or cognitive, but to really keep in mind all these other areas and these domains, because they're really going to affect that person. They're going to affect how well you can do your job, and a lot of times being that clinician who can identify, hey, this isn't quite right over here, or maybe you need to address this issue, is what sets you apart from a good to an excellent clinician. So I hope I answered that question, shed a little light on speech therapy and how these things kind of impact what I do. Hope you guys do well in the class, and good luck. Bye.